Winter is a season that brings cooler temperatures, shorter days, and often a range of health challenges. While the season has its charms, such as cozy nights and festive celebrations, the cold weather can adversely affect physical health in various ways. From respiratory issues to skin problems, the harsh conditions of winter can exacerbate existing health concerns or introduce new ones. Understanding these potential problems is the first step toward prevention and better health management. 1. Respiratory problems. Winter is notorious for an increase in respiratory illnesses due to cold air and the tendency to spend more time indoors, which facilitates the spread of viruses. Common respiratory issues, colds and flu, viral infections are more prevalent in winter, affecting the upper respiratory tract. Bronchitis. Cold air can irritate the airways, leading to inflammation and persistent coughing. Asthma exacerbation. Cold, dry air can trigger asthma symptoms, making it harder for sufferers to breathe. Pneumonia. The risk of this lung infection rises during winter, especially among the elderly and those with weakened immune systems. Prevention tips. Dress warmly and use scarves to cover your nose and mouth outdoors. Get vaccinated against the flu. Use a humidifier to prevent dry air indoors. 2. Hypothermia and frostbite. Extreme cold can be dangerous, especially for people exposed to low temperatures for extended periods. Hypothermia. This condition occurs when the body loses heat faster than it can produce, causing a dangerously low body temperature. Symptoms include shivering, confusion, fatigue, and in severe cases, unconsciousness. Frostbite. Frostbite happens when skin and underlying tissues freeze due to prolonged exposure to freezing temperatures. It typically affects extremities like fingers, toes, ears, and nose. Symptoms include numbness, discoloration, and a hard or waxy appearance. Prevention tips. Wear insulated, waterproof clothing and gloves. Avoid prolonged exposure to freezing temperatures. Stay dry as wet clothing increases heat loss. 3. Dry skin and skin irritation. Cold air, low humidity, and indoor heating can strip the skin of moisture, leading to dryness, irritation, and cracking. Common winter skin problems. Chapped lips. Lips are particularly sensitive and prone to cracking in winter. Eczema flare-ups. The lack of moisture can aggravate eczema symptoms, causing red, itchy, and inflamed patches. Itchy skin, known as winter itch. This condition results from dry, flaky skin. Prevention tips. Use moisturizers regularly, especially after bathing. Limit hot showers as they can further dry out the skin. Apply lip balm and wear gloves to protect hands. 4. Joint and muscle pain. Cold weather can worsen joint and muscle pain, especially for people with conditions like arthritis or fibromyalgia. Cold temperatures reduce blood circulation, causing stiffness and discomfort in the joints and muscles. Prevention tips. Stay active to keep joints and muscles flexible. Dress warmly to maintain body heat. Use heating pads or warm baths to soothe sore joints. 5. Seasonal affective disorder SAD. Seasonal affective disorder is a type of depression that occurs during the winter months due to reduced sunlight exposure. Symptoms include low energy, difficulty concentrating, increased appetite especially for carbs, and feelings of sadness. Prevention tips. Spend time outdoors during daylight hours. Use light therapy lamps to compensate for reduced sunlight. Maintain a regular exercise routine to boost mood. 6. Increased risk of heart attacks. Cold weather can increase the risk of heart attacks. When exposed to low temperatures, the body constricts blood vessels to conserve heat, which raises blood pressure and puts additional strain on the heart. This is particularly dangerous for people with pre-existing cardiovascular conditions. Prevention tips. Avoid overexertion, especially during activities like shoveling snow. Dress warmly to minimize the body's need to work hard to retain heat. Monitor blood pressure regularly if you have a history of heart issues. 7. Vitamin D deficiency. Reduced sunlight during winter can lead to lower levels of vitamin D. a nutrient crucial for bone health and immune function. Vitamin D deficiency can result in fatigue, weakened immunity, and even bone pain or muscle weakness. Prevention tips: eat vitamin D-rich foods like fatty fish, eggs, and fortified dairy products. Consider taking a vitamin D supplement after consulting a doctor. Spend time outdoors when the sun is shining. 8. Weight gain. The combination of shorter days, colder weather, and holiday indulgences often leads to reduced physical activity and overeating. This can result in unwanted weight gain. Prevention tips: stay active with indoor exercises or winter sports. Practice mindful eating during holiday gatherings. Maintain a balanced diet with plenty of fruits, vegetables, and whole grains. 9. Weakened immune system. The immune system can become less efficient during winter due to a combination of factors, including vitamin deficiencies, reduced physical activity, and increased stress from holiday pressures. Prevention tips: eat a nutrient-rich diet to support immunity, get adequate sleep to allow the body to recover and repair, manage stress through relaxation techniques like yoga or meditation. 10. Increased risk of slips and falls. Icy sidewalks and roads make winter a season of higher risk for slips, trips, and falls, leading to fractures, sprains, or bruises. Prevention tips: wear shoes with good traction. Walk carefully and avoid rushing on icy surfaces. Use handrails whenever possible. Winter brings unique physical challenges, but many of these issues can be mitigated with proactive measures. Dressing warmly, maintaining a healthy diet, staying physically active, and managing indoor air quality are key strategies for minimizing the season's impact on your health. By understanding the risks and taking preventative steps, you can enjoy a safe and comfortable winter while maintaining your well-being.